Good Wednesday morning, Northern Michigan. We have puppies in the studio. You can hear them all through the building, actually. This is one of them. Dr. Klabunde, of course, joins us for Pet Talk this morning. She has two puppies, a little girl and a little boy, who are up for adoption.
They are, and this one, she's extra cute. She's been spayed, and she has two different colored eyes, a blue and a brown. So she's adorable.
So you think she's a lab mix?
I think she's a lab husky mix, and she's going to be a big girl. They
What
both
a great
are.
combo.
Yeah, maybe about 70 pounds when they get older.
Wow. If you're looking for a lab husky mix, this could be your match. She's precious. Oh my gosh. And the reason we have you here today, Dr. Klabunde, is talking about, first of all, blood work that you should get done for your dog or cat before they undergo surgery.
Right, it's so important, and it's important. She was already spayed this week. It's important even to do in puppies, older pets especially, but it really doesn't matter what age they are, because we're going to be able to detect underlying diseases. And this is really important when you give them anesthesia that you can't take back. You need to know if their liver or kidneys are compromised, if they have an infection. It's going to give you peace of mind as well. So making sure that you know that everything is normal before you give them the anesthesia.
And so you're looking for any types of possible infections, anything they could be maybe allergic to even, is that?
Sometimes we can see if they're allergic to it. A very, very, very small percentage of dogs are allergic to anesthesia. Normally if they have problems under anesthesia, which can happen, it's due to underlying disease. Like I said, an infection, liver problems, kidney problems. They can't metabolize the anesthetic drugs that we give. So what we want to do is check their blood before we give them this medication that we can't give back, and tailor the anesthesia to them. If they have liver problems, we'll give them an anesthetic drug that is easy on the liver. If they have kidney problems, we're going to go ahead and give them a different anesthetic than we normally do in a healthy pet. Sometimes they need extra fluids during surgery. And so these are all very important things. We've picked up on so many underlying diseases like diabetes that we just wouldn't have known that the pet had we not done blood work prior to anesthesia. And I can honestly say every vet would tell you that this has saved numerous pets' lives.
Oh, I'm sure.
Yeah.
Big deal. Something that I wasn't even really that aware of, so I'm glad that you brought it up. We have another puppy here, too, that Brody brought over.
We've got
this is the boy.
That's the boy. This is the girl. They are litter mates, but you can see how big they are.
These are cool dogs.
Yeah, we were just playing out in the hall, so I wanted to bring this one in.
He just wanted to say hi. Of course, stay with us. We're going to have Dr. Klabunde and both of these puppies back on air in about 20 minutes. We're going to talk about why you should spay and neuter your pets, also where you can adopt these two guys. So stay with us for more information. Taking a look, though, at your weather, here's Storm Team meteorologist Joe Charleboy.
Well, we love Wednesdays here on 7 and 4 News Today because we're always joined by some cute little friends, and Dr. Jen Klabunde, not too bad yourself as well. I want to thank you for coming in this morning. She brought two puppies in. One of them we featured in our last segment, and again, this is the brother of the dog you saw in our last segment. Both up for adoption. We'll talk about them in a little bit, but first, something that all pet owners should have in mind: spay and neuter when you get your pet.
Correct. 6 to 8 million pets are euthanized every year just in the U.S., and that's a staggering number. Most pets should be spayed and neutered. This little guy and his sister were in this week. He was unable to be neutered at this time, but will be very soon. His sister is done, and it's just important not only for health reasons, but just decreasing the pet population.
Yeah, and so, for owners out there who might be getting a puppy or they have one, what's an ideal age for a puppy? Male, female, is there a difference there?
There's not a difference, and we really like to get them spayed between 4 and 6 months of age. That said, it can be done at any age and should be done at any age. So even if you adopt an older pet and they are not fixed, it's really best to get them done. And that's for behavioral issues, it's for medical issues, and like I said, it's just a decrease in unwanted puppies.
Yeah, we were talking about scajoring last week. A lot of dogs are hunter dogs up here and hunting dogs here in northern Michigan. What's the recovery time? Because a lot of folks like to get their puppies trained and kind of get them into what they love to do, which is be outside running around.
Right, so a little different between males and females. Males, they're back to themselves the very next day, but they usually will have skin sutures and that incision needs to heal for about 10 days. In females, it's a little different because we're going into the abdomen to remove the uterus and ovaries, And so it's a little bit more of a involved procedure, but again, it takes 10 days for that to heal and the skin to go back to normal. But it's not the end of the world. It's only 10 days. You can still train your puppy around that.
Right. Yeah. Anything else important for pet owners to keep in mind when kind of beginning that process of looking into getting their pet spayed or neutered?
Well, you know, you want to be smart and informed and know the reasons why you're doing it. And it's not just to cut down on puppies. It's for health reasons as well. And females, it's really important to get them fixed before their first heat cycle, because then their chances of mammary cancer go up exponentially. It's one of those graphs that goes straight up. Also, they can develop life-threatening uterine infections with age if you don't get them spayed. Yeah. Now, males, it can decrease not only your chances of getting cancer, but also getting rid of those unwanted dominant behaviors, like roaming. Did you know that an intact male can smell a female in heat for several miles away? So that's why these males just take off and you don't see them for a while. They're in the hunt.
They're in the hunt, yeah. Well, good things to keep in mind. Dr. Jen Klabunde, I want to thank you so much for coming in and talking about your pets today. We are posting information, I believe at the moment. Was Roxanne working on
She is working on it. Cute video of you and the puppies, and they're available right now to go home.
Great.
They are up to date on their shots, and like I said, neutered. Everything is done. Yeah. And they're available through hands.
Gosh, well, such cute animals. Jen, thanks so much for coming in.
Thanks, Brody.
Let's turn things over to Joe Charlevoix. Stand by with your